The Greater New Bedford Community Health Center monthly video series is brought to you by Senior Whole Health, a health plan for seniors that have both Medicare and Mass Health coverage. Online at seniorwholehealth.com.
Welcome to the Greater New Bedford Community Health Center. We will be presenting a series of seminars which we hope will inform the community and our staff about the benefits which are available to the people that we serve.
Good afternoon. It's my pleasure to introduce Ms. Delia DeMello from the Social Security Department to talk about Social Security. It's my honor to have her on board. This is a second in a series of ongoing seminars for the community and for the people and the employees of New Bedford. Thank you.
Thank you, Mr. DeJopoulos, and to Lois Curley for organizing this event. I am the Metropolitan Public Affairs Specialist with Social Security. I worked closely with some of you present in this room. What I was asked to discuss today is planning for retirement and how Social Security fits into an individual's plan when preparing for their retirement. So Social Security, as we know, is a very important program, not just a retirement program. As you can see, we're the safety net that pays individuals not only retirement benefits, but Medicare, disability, survivor benefits that include not just surviving spouses, but children of the deceased and disabled. So when you think of 53 million people receiving Social Security benefits in one form or another, that's a very significant piece of our economy. So yes, we hear a lot about Social Security and its future, but I think this graph illustrates just how important Social Security is to our national economy. However, when we're planning for retirement, although Social Security is that safety net that we all rely on when we retire, or if we should become disabled, or worse, if we should pass away before our time, it was never meant to be anyone's sole source of income, especially in retirement. It was meant to be a foundation, something for us to build upon, that together with investments, pensions, savings, other type of income, we can live the same as we did as when we were employed. We all have dreams, we all have plans of how we want to spend our retirement, and penny pinching, I'm sure, is not one of them. And planning for retirement today will ensure that we have a comfortable and happy retirement in our golden years. Okay, that's why this message is so important. We do a lot of these seminars with employers, with other community agents, because it's very important that individuals know today, and not when they come to apply for benefits, that they should have been making allotments and preparing for their retirement. Okay. One tool that we were providing to individuals 25 and over is annually we were sending out the Social Security statement. That was a great planning tool. I say was because unfortunately, due to current budget restraints, we won't be able to be sending those out anymore. The statement, as you recall, if those of you who are still receiving them, it chronicles your entire work history and provides you with estimates of what your future retirement benefits would look like at age 62, your full retirement age, or at age 70 if you chose to delay it until that point. The same information, however, is obtainable if you go to our website, you go to socialsecurity.gov and utilize our calculators. They're great planning tools. And unlike the statement that only provides those 3 age estimates, with the estimator, an individual can create what-if scenarios. For example, what if I stop working at age 57? What if I say I've had it, I'm not going to work another day? What impact would that have on my future Social Security benefit? Well, you can add the zeros in, and you can see and have a very accurate estimate of what your benefits would be impacted by that decline or sudden cessation of earnings. On the other hand, if an individual who maybe has been an average or even a lower wage earner now takes on a position where they've significantly increased their earnings, because remember, on your statement, those estimates are looking forward, projecting that your earnings will be the same or a percentage more. into the future. But with the estimator, if you're going to have a significant change in your earnings, you can do that. You can add that to the calculator for future earnings and see what impact that would have. So it's a great planning tool. And even for those of us who aren't near retirement, it's always good to know, especially, again, financial planning is essential that we start early as opposed to later. So it's important to know how much of a percentage or what Social Security will represent to you during your golden years, during your retirement. Because again, we all have plans and dreams and how we want to spend our retirement, and we want to make sure that we have enough so that we can live comfortably. So in order to qualify for a Social Security benefit, we do need to have a specific number of credits. You may have heard the term used quarters previously, but we no longer use that term because a quarter could only be earned in a quarter, but now it doesn't matter. An individual needs to have at least 40 credits to qualify for a Social Security benefit, which equates to about 10 years of work. Will that give an individual a large Social Security benefit? Absolutely not. But with a minimum of 10 years of work, an individual can be insured, can obtain those 40 credits to be eligible for a Social Security benefit. You may have clients or you may know individuals who have a statement that says they're short credits. Perhaps they work for the state. Perhaps they work for the town or the municipality. And where you may or may not know, those individuals don't contribute into FICA. They only pay the 1.2% into Medicare. So if they're trying to build their Social Security credits so as to attain at least something from Social Security, again, it only takes 40 credits. And we set a dollar amount on how an individual can earn those credits. So in 2011, for every $1,120 an individual earns in covered earnings, they can earn 1 credit. 4 is the maximum that an individual can earn in 1 year. One change that occurred that we're only starting to see the significance of in recent years is that the full retirement age is starting to be implemented. This affected individuals that were born after 1938. What was once age 65, the age for full retirement benefits, has incrementally been increased. For individuals that we're seeing file for retirement now, the baby boomers born between 43 and 54, their full retirement age is 66. For those of us born after 1960, the full retirement age will be 67. That doesn't mean, however, that early retirement has gone away. An individual can still apply and receive Social Security benefits at age 62. However, they have to understand that that is a permanently reduced benefit, about 25% less, as opposed to an individual who may delay receiving their benefits until their full retirement age. The other thing that an individual has to consider is if you draw benefits early, and early we mean by any point, any month prior to your full retirement age, there is a limit on how much you can earn from your job or self-employment and receive your Social Security benefits. Okay, and I'll talk about that in a little bit more detail in some of the upcoming slides. A lot of us don't realize, but studies show we're going to spend about 1/3 of our life in retirement. And so the thinking about 20 years ago that used to say to people, well, perhaps you should take your Social Security benefits at age 62. Now the thinking has changed. Now people in the financial world are of the opinion that it's wiser to delay receiving Social Security benefits because chances are we're going to be needing and relying on that benefit for a longer period of time. A lot of us are still working well beyond the age of 62. And so that these are things that an individual needs to consider when deciding when to retire or when to start drawing Social Security. Number one, again, age 62 or any point prior to full retirement age is a possibility, but the individual needs to understand that that is a permanently reduced benefit, and there is a limitation on how much they can earn from their job or self-employment if they are still working. Another strategy, so to speak, so as to fully maximize what an individual can receive from Social Security, and this is an option that sometimes individuals who do not have a pension do not have any type of defined benefit from their employer, or sometimes even the self-employed will take advantage of, is if an individual delays receiving their Social Security benefits even beyond their full retirement age, they can increase their Social Security benefit another 8% for every year that they delay it past their full retirement age. If they wait until age 70, that individual can gain an additional 32% on top of their full retirement amount. Again, excuse me, beyond age 70, they wouldn't gain any additional benefit. And no, unlike IRAs and other types of investments that the government obliges you to start taking withdrawals from at a certain age, we won't make you take your benefit at that age, but you're not going to gain any more either by delaying your benefits past age 70. But again, this is an option for some individuals who may not rely on the income, may not need the Social Security income at that point because they're still working. Maybe they don't have pensions or types of defined benefits from their employers. So Social Security may represent a larger piece of their retirement portfolio. And especially if they're still healthy. These are all things we need to consider when deciding, too, when to start drawing benefits. What's your longevity? What's your health? Are you still working? These are all things to consider that will help an individual decide when the best time is to start drawing benefits. And unlike most pensions through employers and defined benefit plans that look at the best 5 years or maybe the highest 3 years of an individual's earnings to determine their benefit, we're looking at a lifetime of earnings. This is why it's so important that when we were sending the statement, we wanted people to review the chronicle of their work history to make sure that they were getting credit for every dollar that they earned. Because our formula looks at an individual's best 35 years of work. Remember, as I said earlier, it only takes a minimum of 10 years of work to qualify for a benefit. However, the formula does ask for 35 years, and so we're adding zeros for those remaining years. And for those individuals who perhaps have worked for the state or for the towns or municipalities where perhaps they just have the minimum paid into Social Security, any earnings that they have post-retirement and any part-time work will help increase their benefit. As those earnings are reported to us by the IRS, we will automatically recompute their Social Security benefit, which will replace one of those 0 years and automatically give them an increase in their Social Security benefit. It used to be that an individual had to come in, submit their W-2 or 1099 if they were self-employed, their tax returns, and ask us to recompute their benefit so as to get credit for that additional year of earnings. That's no longer the case. We're in the electronic age, and the exchange of information occurs so rapidly that the individual gets the letter and the check very shortly after the earnings are reported to the IRS. So what will Social Security represent in your retirement as far as replacement of your pre-retirement income? Well, as this graph illustrates, for the average wage earner, Social Security is going to represent about 41% of an individual's pre-retirement income. Again, just emphasizing how important it is to make sure that we have other types of savings and/or investments to help supplement that. Other than the retired worker, there are other family members that may also be eligible for part of that Social Security benefit. A worker may have a spouse who may have given up a career to stay at home and raise the children. That spouse can receive up to 50% of the worker's Social Security benefit, and it does not reduce or take away from the worker at all. If a retired individual has minor children, and what we mean by minor is under the age of 18, or 19 if they're full-time in the high school, a child, too, can qualify for up to 50% of the worker's Social Security benefit. If an individual has a disabled child, even a disabled adult child, as long as that onset of disability occurred prior to age 22, that child can receive benefits beyond age 18, which includes Medicare. And again, unlike our other needs-based disability program called SSI, which some of you may or may not be familiar with, which is needs-based, Social Security is not. So this is very comforting to those individuals who have children that won't otherwise be able to sustain themselves. It's very comforting for those parents to know that when they retire, that child will be eligible for part of their Social Security benefit. And if they should pass away, that benefit automatically converts to a survivor benefit, which the percentage would then change from 50% to 75% of the worker's Social Security benefit. Now, ex-spouses, we say they're special because unlike a married current living with spouse who has to wait until the worker files and starts receiving Social Security, an ex-spouse does not. As long as they meet the duration of marriage requirement, which is 10 years, an ex-spouse can file on a current, former, or deceased spouse's record. And again, that's only if 50% of that ex-spouse's Social Security benefit is greater than their own. A lot of us work today, most couples are two-income households. And so this is to protect that spouse that maybe, again, was not gainfully employed or not employed at all. But it could be still, even if the spouse was employed, they were the lesser wage earner. And so these laws are to protect those individuals. Medicare. Medicare is the federal insurance benefit that the retired will be eligible for at age 65. And again, age 65. Although an individual can retire and start drawing benefits as early as age 62, medical insurance through Social Security or Medicare is only available at age 65 for a retired individual. Some folks can qualify at a younger age, but that's if they're eligible for benefits from Social Security as a disabled worker, at which point they would be eligible after serving a 24-month waiting period. We can also offer Medicare coverage for individuals that are going through a course of dialysis. In general, it's a 3-month waiting period, again, and virtually at any age. Even if the individual doesn't have enough work credits of their own, they can get those credits for Medicare coverage through a spouse, or and when we're talking about children, through a parent. What is Medicare? Medicare has several parts. There's Part A, Part B, sometimes C, and D. Part A is your hospital insurance, and that has no cost as long as the individual is insured and eligible for a Social Security benefit. It does have a deductible. This year it's $1,132. Those individuals that will purchase or will be eligible for Medicare supplements, those supplements or MedEx plans generally cover that Part A deductible. Part B is the part of Medicare that most individuals utilize the most. This year it's $115.40. It's automatically deducted from an individual's Social Security benefit. However, if an individual files for Medicare at age 65 and chooses to delay receiving their Social Security cash benefits, we would bill them quarterly for that monthly premium. You notice there's an asterisk after that premium, just to be aware that the premiums for Medicare generally were the same for everyone. However, some folks thought that wasn't fair, and recent legislation has made it such that individuals with higher income will pay a higher premium for their Part B and thus have less subsidy from the government for their Medicare. All right. Generally speaking, for individuals with income in excess of $87,000 per year will pay slightly more for their Part B premium. For couples filing jointly, income in excess of $170,000. And again, for individuals in higher income brackets who want more information and more details about how that works, you can go to our website, go to socialsecurity.gov, click on Publications, and choose the publication that says information about Medicare premiums for individuals with higher incomes. Again, about Part B, if you notice it only covers 80%. While it's not mandatory, we do highly recommend for those individuals that will not be eligible for any type of Medicaid or mass health coverage that they consider purchasing a MedEx or a Medigap plan to supplement their Medicare. 20% can represent huge dollars every time you visit the doctor. Part B covers not only doctor's visits, but emergency room visits, tests, outpatient visits, therapies. Okay, so what we do is recommend individuals to look at Medicare's website, where they can find lots of information about the various Medicare plans or Medigap plans. And the most wonderful and useful and user-friendly resource that they have in their communities is to contact their local Shine counselors. Calling 1-800-AGE-INFO, an individual can be connected to their local Shine counselor, where they can be counseled on the various Medex and Medigap plans available to them, including Part C plans, which represent Medicare Advantage plans. These essentially are HMOs that govern the person's Medicare insurance. In this area, Tufts is the plan that's widely available, but individuals should know that going into those types of plans, that while there may be cost savings associated with it, there are some limitations in which they can only seek treatment with providers that accept that type of coverage. Then brings me to Part D, the last part of Medicare, most relatively newest piece to Medicare. While, again, this is not mandatory that an individual enroll, we highly recommend it if the individual does not have other creditable coverage for their prescriptions. Where an individual will be automatically enrolled in Part A and Part B, if they retire prior to their full retirement age, we will automatically enroll them in Medicare, not Part D. Part D is represented by numerous private companies that are Medicare approved, but they are private nonetheless. So Social Security cannot endorse one plan over another. Again, this is where an individual should seek the counsel of a Shine counselor who can help them through what can be confusing choices. Again, but for those that are computer savvy and able to do the research themselves, if they go to Medicare's website and choose the My Prescription Finder link from Medicare's website, which is medicare.gov, G-O-V, there is wide amount of information available. The individual just has to enter limited information, name, social security number, address, and they also need to list the medications that they take. And that link will help them decide which plan best suits their needs. An individual shouldn't really go by what a spouse may already be enrolled in for Medicare Part D, because their individual needs may differ significantly. Okay, and just like Part B, where if an individual does not enroll when they're first eligible, there are penalties associated for late filing. Okay, there are no penalties if the person delays enrolling in Part B or Part D because they're working and have insurance through their employer group health plan, their own, or even by virtue of coverage through their spouse. But it has to be through active employment. Otherwise, there are permanent and ongoing penalties associated for late filing. And again, just to illustrate some of those income brackets, which a higher assessment for the Part B premium may be assessed. This is just a general synopsis of what those brackets are. But again, for more details on that, I would advise that you go to our website, choose that publication that gives you more information. When to enroll in Medicare is key. If an individual is approaching age 65 and not covered through an employer group health plan, we advise that they enroll in Medicare 3 months before their 65th birthday. That is their initial enrollment period. If an individual refuses or forgot to enroll in Medicare at that time, they can contact us during our general enrollment period, which runs from January 1st through March 31st. However, because of late filing, that coverage would only take effect in July of that year, and there would be a 10% penalty for every year that the individual refused enrolling in Part B. The special enrollment period is the 7-month window that an individual gets if they delay receiving Medicare or enrolling in Medicare because they were working and had coverage through their employer. As long as they contact us to enroll in Part B within 7 months of their employment terminating or their insurance, whichever comes first, there is no penalty involved in enrolling in Part B, and they can choose the month that they want it to be effective. At that point, we would advise them then, if they're not eligible through any insurance, through their employer post-retirement, to then research and look into possible Med-Ex or Medigap plans, including Part D plans, to supplement their Medicare. Again, while we are usually considered the face of Medicare, Medicare is its own agency. So if individuals have questions about coordination of benefits, what Medicare covers, what it doesn't, percentages and otherwise, medical equipment, we would advise that they visit Medicare's website or call their number, 1-800-MEDICARE, where a customer service representative should be able to answer most of their questions. Again, I had mentioned that there are limitations for an individual who decides to take benefits early. This year, for an individual who takes benefits prior to their full retirement age, there's a limit of $14,160 that they can earn without losing any of their Social Security benefits. If the individual exceeds that amount, even despite their best intentions, the payback is $1 for every 2 earned in excess. Now, an individual who is retiring in the year that they're going to attain full retirement age, the earnings limitations are significantly increased, and most folks are not aware of this special provision. If an individual files for Social Security in the year that they attain full retirement age, Social Security is only concerned with what they earn in the months preceding their full retirement age. For example, an individual who would file for Social Security benefits in January of this year went to socialsecurity.gov to apply for their benefits, but will only be age 66 in June. Social Security is only concerned with what their earnings would be from the month of January through May. And as long as they earn less than $37,680 in those months, from June forward, they can earn whatever they want. However, if in those 5 months the individual did exceed that amount of $37,680, the payback would be $1 for every 3 earned in excess. So just an illustration of our website, which is really the most user-friendly and most recommended way to do business with Social Security. It's safe, it's secure, always open, no parking issues, and an application for retirement can be completed in as little as 15 minutes. An individual is just interested in getting an estimate of what their benefits are from our webpage by clicking on retirement or even by clicking on estimating my benefit. They'll be linked to this page where they can choose to either start or estimate their benefits. Even for those individuals that are contemplating filing for disability, disability benefits can also be filed online. And again, because of the nature of the disability application requiring a lot more extensive information, obtaining an individual's medical history, little more time consuming than a retirement application, which can be done in 15 minutes. The disability online process is very convenient in that an individual who is ill and the last thing they want to do is sit in an office for an unusual, what can be a longer wait. While our office is still open and willing to help any individual who needs it, it does give individuals another option, another alternative to do business with us. Again, safe and secure, just as safe as going to the office and doing business with us. But again, unlike going to the office where if an individual comes in, they can't leave until they finish. With the online version, an individual can start the application. If they don't feel well or perhaps they don't have all of the information at hand, they can save that information and then go back and finish where they left off until they're ready to finally submit that application to us. Follow-up will be made with a real person that will acknowledge receipt of that application and follow up with any documents or information that we may need. So again, do share with your friends, family, colleagues, clients that this is another alternative, another way to do business with Social Security. So now I'd like to open it up to questions if anyone should have any.
I was talking to a Shine coordinator. I have a disabled son. He's 35. She said he should have gotten a Medicare card. He's been on SSI since he was 5. I don't have a Medicare card for him.
He would get a Medicare card if he was receiving a Social Security benefit. By virtue of a parent being retired, receiving retirement benefits, or disability benefits, or having a parent who is deceased. An individual who's on SSI will be eligible to enroll in Medicare at age 65. But if the individual is 35, well, then they could only get Medicare, again, if they have a parent who is retired, receiving benefits, disabled, or deceased.
Okay, so do I have to apply for that?
If the child is already receiving the Social Security benefits, they would automatically be enrolled in Medicare after a 24-month waiting period.
So he has to wait 24 months from the time I started getting benefits.
Right.
For him.
And if you have questions about that, you can call and ask, and perhaps the card was lost in the mail and it's just...
I haven't been on it long enough then.
Right.
I have a client that got his Medicare card after 2 years. He's disabled, he's 44, and he's like a foster person because he was given up at birth, and he works, and he got a Medicare card after 2 years.
Right. Anyone who's on disability benefits, Social Security disability benefits, they will automatically be enrolled in Part A and B of Medicare. We'll send them the card automatically. Yeah, the people that need to enroll in Medicare are those folks that are approaching age 65 and are not receiving a Social Security benefit from us, but want Medicare at age 65. For example, those individuals who might choose Medicare even though they're still working, some folks that are self-employed, paying for their own health insurance and probably paying a significant penny for it, Medicare can be a more affordable option. Any other questions?
Mr. Mello, my name's Phil Paleologus. Hello, how are you?
Nice to meet you.
Thank you. And I'd like to ask some questions on behalf of the Greater New Bedford Community Health Center's retirement seminar, okay? First one we have written down is, I understand that Social Security has a website that individuals can visit when they're planning for their retirement. Can you explain, what types of tools are available that can help someone determine when they should apply for benefits?
Absolutely. Social Security has a very popular and very user-friendly website at socialsecurity.gov, where we have not only all of our publications, the latest and most up-to-date versions, but we have calculators, not only for individuals who have been employed in the private sector, but even for those individuals who may have worked for the state or the municipalities, and they're going to be affected by those provisions known as the windfall elimination provision or even the government pension offset. We have calculators specific to them so that instead of having to take time or a day off out of work to go into a local Social Security office and ask a claims representative to do those calculations for them, from the convenience of their own home, they can click on the calculator and get that same information and have the ability to create those what-if scenarios, adding additional earnings under Social Security, so that they can see what impact that would have on their final benefit. We also have links to other government agencies. mymoney.gov is one, and there's another one that an individual can get a screening online for all types of federal benefits that they may qualify for. So there's a wealth of information on the website, so I would encourage everyone who hasn't already visited to do so.
Another question that we have is, what other types of business can an individual conduct through the Social Security's website? Is there any other type?
Oh, absolutely. The other types of business that an individual can conduct other than utilizing the calculator or looking at all of our publications, laws, regulations, and frequently asked questions section, an individual can apply for their retirement or their Medicare, or even disability benefits online. Our Extra Help program related to Part D of Medicare, which can help individuals save almost $4,000 a year with their prescription costs. That application, which can be completed by virtually anyone who's willing to help a senior or a Medicare beneficiary, can also be completed through our website. Unlike the paper applications that you might find at the senior centers, the applications that come in through the internet receive priority handling. So really, it's the most preferred method for an individual who's trying to get the quickest response possible. For those retired individuals already collecting benefits from us, or even disabled beneficiaries already receiving benefits, simple transactions that required visiting the office or calling and being on hold for an unusual amount of time, like changing an address, changing a phone number, requesting or changing their direct deposit, replacing a Medicare card, can also be done through the website. So again, a lot of time-saving options through our website.
That's great. However, what if a client isn't able to, let's say, access a website? Is there an alternative way to do business with Social Security?
Right, absolutely. And in this community where we service individuals who speak different languages, if they have a relative, family friend who's willing and able, with the individual's consent, to use the website, that's absolutely permissible. But if that is not an option, we certainly can recommend that they call our 1-800 number. And that number is accessed Monday through Friday from 7 a.m. to 7 p.m. And that number is 1-800-772-1213.
And perhaps this goes over a little bit of the same information, but what if someone does not have internet access, or a family member that can help them with online services? What other ways can we do business with the Social Security office to avoid, any of the actual visiting, the physical visiting of the office?
Right. Well, again, most of us have computers at home. And again, just speaking personally, my parents, non-English speaking, not computer savvy at all. But if they have an interested relative or trusted person that can help them conduct business with us through their own computers, that would be the preferred method. Saves the individual having to ask someone to come in and translate, having to take time out of work to go into the office with them. As long as the individual grants permission, they can absolutely have a family member or trusted friend help them.
And this can be done over the phone? It can be conducted over that 800 number, perhaps?
Absolutely. If an individual, through no other means, has no other access to the website, they don't have a computer themselves or don't have a family member or friend that can help them use their computer, absolutely. An individual can request a phone appointment with us. They can make an appointment through the 1-800 number and ask that we phone them at a specific time if they're seeking benefits for retirement, disability, Medicare, or even SSI, our needs-based program.
And let's say your parents, who don't speak English very well, needed assistance. Where can people get assistance in choosing a Part D plan and information?
Choosing a Part D plan can be very confusing for individuals, even those who do speak English. I've had lawyers and doctors scratch their head when trying to decide what they should do. But really, the best resource that they have in their community is contacting their local Shine counselor. We're lucky to have one right here in the audience, Mary Bessie from the regional Shine office in Middleborough. An individual can contact Mary or one of her other helpful staff members at the Middleborough COA or any one of the New Bedford COAs, or by calling the general number at 1-800-AGE-INFO.
And finally, is there any assistance available to seniors and Medicare beneficiaries who might be struggling with the added expense related to Part D?
Absolutely. We understand that with the introduction of the Part D program, that was an additional cost for seniors, another additional out-of-pocket expense. And we do offer assistance through Social Security, which can save an individual up to $4,000 a year. That application they can find in paper format at senior centers, but really, again, the most convenient, safest, and quickest way to get a response and a determination from that program is by going to our website, clicking on the Apply for Extra Help tab. It's a very simple application and can be submitted by any interested party who's willing to help a senior who has Part D.
And finally, could you repeat the 800 number one more time as I thank you so much for your great information?
Absolutely. That number is 1-800-772-1213. Do we have another question?
Are you able to mention what the eligibility guidelines are for the extra help right now for an individual and a couple?
For a couple, generally the resource, they have to have less than $25,000 in resources. For an individual, less than 12. And those figures can change annually, so we would recommend that you check the website to get the most up-to-date information on those guidelines. Any other questions? Thank you. Thank you.
On behalf of the Greater New Bedford Community Health Center, I want to thank Delia DeMello. This was very informative. I think you all agree. And thank you very much, Phil Palaiolos. See you next time. Thank you very much.